Dan Williams, Survive Outdoors. If you're new to the channel, I want to let you know I am licensed and certified as a PA, and I practice urgent care medicine for greater than 40 years. I also have a doctorate in clinical psych. Specialize in urgent care medicine, wilderness medicine. Wilderness medicine deals with zoonotic illnesses, ticks, mosquitoes, snake bites, wasp and bee stings. Also, we deal with traumas in the outdoors, and we're going to teach you how to splint and take care of wounds and so on and so forth. We also do practical survival and gear reviews. So if you like that stuff and you want to learn, hit the subscribe button, hit the bell, you're going to be notified for all of them. Hey, have an announcement. We actually have in hand product. So we have a coffee mug with the Survive Outdoors logo, keep your eyes on the horizon, face to the wind logo on there. We have buttons, and we have t-shirt, pretty cool design. Applaud my wife for that design. And actually, this is some pretty heavy quality shirts, I have to admit. Heavy, not the cheap junk. This is the logo, Survive Outdoors. If you're interested, you want to show people that you can survive outdoors, grab a shirt. In the description below, you'll find the link. All right, today we are hitting it on sunburn treatment. What is the treatment that you're going to use in the outdoors? What is the medical treatment? And the new 2021 recalls that just came out in the last 60 days. Here we go. Sunburn. I'm going to assume that every single person watching this video has been burnt with UV radiation. If you hike, backpack, anything in the outdoors at some point in your childhood, young adulthood, you have had a sunburn to some degree. So I'm going to give you in the beginning of this some of the stats. We're going to talk about UVA, UVB, what that is, and then we're going to talk about radiation and signs and symptoms treatment. And then at the end, we're going to talk about a new recall that within the last 60 days has come out on certain sunscreens, and we're going to show you and tell you what those are and how you can get some money back. So right off the bat, sunburn is obviously your skin gets very red, and there's certain degrees of that burn on your skin. So a sunburn is measured in MEDs. And MED stands for minimal erythematous dose. Erythematous means red. An MED is the amount of radiation or redness on your skin that is perceivable in a given amount of time. So if you're in South Texas, Brownsville, Texas, at noon during the summertime, your MED at that point in time could be about 20 minutes before you see MED, which is the perceivable redness on your skin. That's going to change if you're higher up on the latitude in the United States, and it depends on where you're at. There's a lot of variables with the MED also. How fair your skin is, how old you are, so all of these other variables play a role. But the MED becomes important because that is partly how it's used to measure SPF. So the MED is used when they do the SPF, which is the sun protective factor. So how is that MED measured? Just for a gee whiz fact, okay? So you're not going to use this. It's just kind of cool to know. A SPF is measured by, you take the MED, the minimal erythematous dose, without sunscreen, and that is the denominator, and the numerator in this ratio is the minimal effective dose with sunscreen. That will then give you your SPF of 15, SPF of 30, SPF of 50. I thought it was kind of neat to know that. You'll probably forget it in about 30 minutes, and you should, because it's not going to matter. All right, so what are the signs and symptoms of a sunburn? So obviously redness, and then you can get severe cases of blistering. I'm going to show you some pictures here of a gentleman I treated. This is a pretty bad sunburn on his chest, down his back, and this would be a first-degree burn. Second-degree burn is when you have the blisters, and we're going to talk about that treatment here in a second. So the three rays that you should be familiar with are UVC, UVA, UVB. UVA rays are the longest rays out of the sun, and they penetrate deeper into the skin. The UVB rays are shorter, however, they also cause severe redness of the skin. The UVB rays and UVA rays both can cause cancer. So please be advised, they're both very dangerous. The UVA, that usually takes longer before you become red. Just think of the fact that those rays go deeper into the skin. The UVB rays, in about 2 to 4 hours, you're going to notice the redness. You'll even get that right through the car window if you're driving. There's plenty of photos you can find on Google of truck drivers driving, and one side of their face will be extremely wrinkled, and the other side will not be, and that's because of those rays penetrating that glass and they're driving long distances. So be aware of those two, UVA, UVB. The FDA a few years ago, I don't know, 10, 15 years ago, placed a restriction on all sunscreens that had to have on there whether the sunscreen is UVA and UVB protective or just one. So that has to be on the sunscreen when you buy that. So signs and symptoms of a suntan, sunburn, suntan. The signs and symptoms of a sunburn. So redness, first degree, painful. Second degree, you're going to get the blisters. And there's some controversy on do you take the blisters off. So number one, you go out during the day, you get sunburn, you get the blisters, keep them on. If it's so severe it's second degree, you're probably going to come into the clinic, and at that point we're going to remove them. We're going to put some topical cream on, we're going to bandage those. If you're out for 3 or 4 or 5 days and you're on a trip and you're camping and you're out there, you're going to remove the blisters. Remove the blisters. People, oh no, don't remove the blisters, it's a protective covering. No, remove the blister. You're going to have your medical kit that we spoke about that you have on you. You're going to take it and you're going to bandage those blisters. They're going to rupture anyway when you put your shirt, you're walking through the woods, you're hiking. So remove the blisters, bandage it, you'll be fine. They're going to heal quicker that way than you rubbing them off and becoming very irritated. I have seen maybe 3 or 4 cases where the sunburn was so bad that they had nausea and vomiting and severe dehydration. So one of the things that happens when you get severely burnt is you have fluids that come to the surface, trying to cool yourself off. So increasing fluids is really important, which leads us right into treatment. Aloe vera gel, yes, it definitely helps. It helps with the burning. A lot of this treatment is going to be cowgirl and cowboying up, because it's going to have to go through 4, 5, 6, 7 days before it gets resolved. Now, if you come to the clinic, the treatment that we're going to advise and give, if it's really severe, is prednisone tablets. Helps tremendously with sunburns. Ibuprofen, you could definitely take ibuprofen as an anti-inflammatory. Tylenol will just help with the pain. Cool washcloth, cool compresses 4, 5, 6 times a day. The xylocaine and the sprays, they help for just a few minutes, and that's about it. Moisturizing cream every night. Aveeno, you can put on just a pure Aveeno cream. I'm not talking about sunscreen now, just a moisturizer that is unscented. So coming into the clinic, what we'll do, even on first and second degree, is we're going to assess the severity. You're going to get prednisone, most likely. That is going to be your quickest route to pain-free. If you're home, you can do ibuprofen. We're also going to take off the blisters, bandage with bacitracin or Silvadene. Bacitracin is over the counter. I remember I said keep it in your med pack, so if you're in the outdoors, you can definitely do that on your own. So the only needs you're really going to have to come into the clinic or into the emergency room is if you notice you're getting dehydrated, or you have nausea, vomiting, or the pain is just absolutely unbearable. I've had a few cases that literally a woman was so badly burnt she had to be escorted in by her husband because she couldn't open her eyes, they were so swollen. So that is the treatment of your sunburns, whether you're in the outdoors or whether you're coming into the clinic. That is what we're going to do. Prevention of sunburn. Don't go in the sun. That's one, right? They make tons of different clothes. They are pricier. Columbia has a great line of shirts, long sleeve, short sleeve, that are protective against the UVB and UVA. Now, I mean, a regular white cotton t-shirt, just run-of-the-mill, fruit of the loom, white short sleeve t-shirt, has an SPF of anywhere from 10 to 11. So you're still going to get burnt through that t-shirt. So these, a lot of the clothes and hats that they make for this, they range anywhere from an SPF of 20 up to 40, even 50. So look at that, and if that's something, if you're in Arizona or you're out west, it doesn't really matter, but if there's a lot of sun where you're at and you don't get a lot of those cloudy skies, you might want to invest in that, especially if you're doing a lot of outdoor work. A lot of fishing guides invest in these clothes, so they are helpful for sure. Sunscreens, protection. Before I jump into the common ones, they do make, for all those that are into scuba diving and skin diving and heading out to the beach and exploring the oceans, they make one that is called, what is it called? Safe Sea. And it's really awesome. So this Safe Sea sunscreen, put it on, and what it does is it also protects against jellyfish stings and nemocysts. And so these cysts, these are the little eggs from the jellyfish. I've seen probably a half a dozen of these bites, and what these bites do is they go underneath the bathing suit, and they're trapped, and so that's when they bite. So you'll have somebody come in and they'll be in a gown, I look, and they'll be just bitten around the breast area or around where their lower trunks are. If they have a full one piece on, they're bit just there and their extremities are totally fine. So Sea Safe is really, really a good product and really helps in terms of jellyfish bites. Good to know in the wilderness and in the ocean, obviously. So the other sunscreens that I want to talk about, there's tons of brands out there. There's Coppertone, there's Banana Boat, Neutrogena. And so before I was getting this video ready, and I wanted to go to the store and buy a bunch of sunscreens. So I did. I bought from CVS, and I got some Coppertone, got some Neutrogena, maybe I did. We'll talk about that. So I get these sunscreens, Banana Boat. And what I wanted to tell you is that there's two types of sunscreen. There's chemical, and then there's mineral. And they use the word mineral. Really all mineral is a sun blocker. Mineral has been around for years. So the chemical is where it diffuses the sun rays, whereas the blocker literally blocks the rays. So I have all these at the counter. I'm going to buy them. They didn't know I'm going to return them the next day, but so I get these, and they will not sell me the Neutrogena. So I go, well, why is that? And they said, well, it's been pulled off the market. Do you know why? They didn't know why. So I get home, I research, and lo and behold, we actually have this at home. So this is Neutrogena Ultra Sheer SPF of 100. Now it should be noted that when you're purchasing a sunscreen, you want to get basically 60 or less. It has been proven in numerous studies that the SPF, anything over 60 does no more good. So SPF of 60 is fine. So as I'm doing the research, I'm going to show you a couple studies. One is from Yale, one is from Harvard, that in the last 6 months, these have been posted in Washington Post, the LA Times, the New York Times, that the benzophone chemical is basically it gets absorbed in the skin after you put it on and can stay in the bloodstream for up to 7 days. Actually, that's about 700 times longer than mosquito spray DEET. So Neutrogena, Banana Boat was taken off, and some of Coppertone products were taken off the market because of that chemical. Now, Coppertone has zinc, this one has zinc oxide in it. This is for babies. And zinc oxide and titanium dioxide are two of the nice blockers of UVB and UVA. The chemicals is what I just mentioned, the benzoin and the, I think it's oxybenzoin. Those are the ones that are concerning, and they took these all off the market. Now, so this is what happened. So I had this at home. And this is a big shout out for the Neutrogena company. Talking about integrity, I'm impressed. We purchased this probably, I don't know, a couple years ago, year and a half ago. So we get on, my wife gets on the site, and within literally 2 hours of her writing and sending a picture of it, they're going to reimburse us, like, I think it's $12 for this bottle. So if you have any Neutrogena sprays or lotions for sunscreens, check out their website. You're going to get your money back. So sprays versus lotion, we need to talk about that briefly. So sprays are easy to put on, but they're not uniform. They're sporadic as hell. They're all over the place. You are not going to get an even coating and protection with a spray as opposed to a lotion or an ointment. The majority of these are a lotion. They do make some with an ointment. So how much do you put on? For your face, you should have about the size of a nickel, or your thumbnail should cover your whole face, and the thickness should be about the thickness of a nickel, no more than that. So for both arms, you want about that much to the first crease of one of your fingers is about how much cream. That much should be put on one arm, no more than that. So creams you can put on much more effectively and uniformly than a spray. So there you have it, guys. The sunscreen recalls, you know about those. You can get your money back. Get a mineral instead of chemical. The minerals are the sun blockers. Protect yourself against skin cancer. There's about 3 million cases a year in the United States. With that, stay safe, keep your eyes on the rise and your face to the wind. I'll see you next time.